Today's lecture, we will explore the clinical difference between septic arthritis and osteomyelitis. Last time I discussed the topic septic arthritis, so I decided to go over the basic differentiating point between these two conditions, which are quite serious, and they affect the bone and joint health. So understanding these differences is crucial. So while we are working in emergency setting or we are in the ward, we should be able to understand these differences so that we can make accurate diagnosis and effective treatment. So, importance of differentiating between the two conditions. They both are critical diagnoses. So, it is important that we diagnose it correctly, as misdiagnosis can lead to ineffective therapies and it can lead to complications. So it is very important that you assess your patient correctly. And there are different criteria which we have discussed in our previous lecture, the Cocker's criteria, to work out for the septic arthritis as well. I would go over the causes and risk factors again for septic arthritis very briefly. So the risk factors are bacterial infection. You can view the previous lecture on my channel. Joint diseases, existing joint disease that further weakens the joint, immunosuppression, and recent joint surgery. When we talk about osteomyelitis, so osteomyelitis, direct infection. Osteomyelitis occur due to direct infection. How? From trauma or surgeries, potentially leading to severe complication. Systemic infection. It may also develop from systemic infection that is spread through the blood stream into the bones, and they require timely treatment. The risk factors, most likely the same: diabetes, vascular insufficiency, and chronic illness, of which require careful monitoring to prevent complications. Let's take a look at this table of comparison between osteomyelitis and septic arthritis. The cause is the same in both osteomyelitis and septic arthritis, bacterial infection, and the most common one is Staphylococcus aureus. The area is basically the main thing by which we can assess whether the patient is having osteomyelitis or septic arthritis. So if long bones and spine and pelvis are involved, for example, your patient is complaining of pain in their long bones, maybe spine, maybe pelvis, or other patient is complaining of pain in joints, knee, hip, and shoulder. So these are the prompting points where you can decide, oh yes, this one could be the case of osteomyelitis and this one is septic arthritis. Okay, and also you can also use your Cocker's criteria to diagnose septic arthritis. Clinical features remains the same: pain, swelling, and limb pain. Range of motion will be more markedly affected in septic arthritis, and it is variable in osteomyelitis. How would we diagnose? What investigation we would do? Blood test remains the same. We will check the blood culture, CRP, full blood count, UNEs, etc., clotting profile. Imaging test, MRI is the preferred one for osteomyelitis. We can do X-rays, but MRI is preferred one, and bone biopsy to see the extent of bone damage. In septic arthritis, you can see we have done the blood test. We can do joint aspiration and other imaging studies such as ultrasound, which is the commonly used to diagnose septic arthritis. Treatment, and both cases receive antibiotics. Surgery to remove infected bone, and joint drainage for septic arthritis. If you don't diagnose, if you miss the diagnosis of osteomyelitis, I hope after going over this, you won't be able to miss this, and you will be able to pick the diagnosis more rapidly. So the complication can be chronic infection, bone death, and amputation. For septic arthritis, it can lead to joint damage, chronic infection, and life-threatening sepsis. So these are the differentiating points where we can quickly assess and do our prompt diagnostic measures and treatment, and we can save our patients. Thank you so much for viewing, and I will be posting some upcoming videos soon. And don't forget to like and subscribe. Thank you so much for your support and keep learning. Have a lovely weekend. Bye.